The nation's health secretary reportedly plans to remove restrictions on selling peptide injections, making them available to more people. What does this mean? Well, Dr. Abby Waldman, a dermatologist, social media star at Mass General Brigham. And I say that because you really are such an important follow on Instagram and all the places that you are, because you're so knowledgeable and you give really good information. You get a lot of questions about peptides. I just asked you about that. It's a glow-up potion, it's the Barbie drug. You've done the research, you've read it, you know about this. Describe what these are and what they do and then what they really don't do.
Yeah, so peptides is first to understand what is a peptide. So it's an amino acid chain. We make them in our own body. Okay. And you've probably heard of some of the FDA approved peptide drugs like Ozempic. The GLP medications are an example of an FDA approved peptide drug. Now, there is a whole category of injectable peptide drugs that are not FDA approved. You hear about them on the internet. They're very popular in the health and wellness sphere, and they're reported to help with skin health, with wound healing, with different things, but they are not FDA approved or FDA regulated, and so people have to get them on the black market. So what you're describing is that the FDA is thinking about moving about 14 of these drugs into a different category where at least you could get them prescribed by a doctor and get them through a compounding pharmacy. It doesn't mean that they've been proven to be safe and effective. They wouldn't be FDA approved, but you would at least be able to get them in the United States under supervision of a doctor.
The health secretary, RFK Jr., says that he uses these shots to personally treat his own injuries. I don't even know how that works, so I'd like to know how that works. Is this something that you've done? Is this something that you recommend your patients do?
I really don't recommend anything that's not under the supervision of a doctor. So if these drugs are not FDA approved, I do not recommend it. There are the infancy of a research area in using peptides for wound healing. Most of these are injected by a surgeon either during surgery or after surgery to help with wound healing or clotting or bleeding. Again, not many of these products are on the market, but they do exist. I don't know if that is what he is referring to, but there are some that do exist, and I think probably there'll be more to come.
Really quick question. So I didn't know about any of that, but I know about collagen peptides because I stick that in a scoop in my coffee in the morning. I have no idea if it even works. I just, that's what you do.
Yeah.
Is that the same thing?
Yeah, collagen peptides is a type of peptide. And basically, in terms of skincare and skin health, there are some data to show that collagen peptides can help. High protein diet probably helps in the same way to make more collagen.
Foods, right? I know.
But you can add a peptide serum to your skincare routine. Again, this is topical, not injectable.
Okay.
For like a little boost to your skincare routine. I do recommend that to my patients. Okay. I don't recommend any injectable peptides that are not FDA approved.
Okay, that's the bottom line. She's Dr. Abby Waldman. Where do people follow you?
You can follow me on Instagram at abby.waldmanmd and on TikTok and YouTube.
Okay, wonderful. Thank you, doctor, as always.